Hello everyone, drberkkkaratas. Premature ejaculation is one of the most common sexual disorders of men. Today I will try to tell you how we deal with the problem of premature ejaculation in about 8 to 12 weeks by working for 20 minutes a day. First of all, let me talk about the sexual cycle. I've explained this in previous videos. If you haven't watched it, please watch this. Now, when sexual desire comes, here is a certain foreplay situation, then the penis enters the vagina. In this place, we call it the pleasure area. Then, when an ejaculation reflection comes, then ejaculation occurs and this is over. We have already talked about how this period takes about 5 to 6 minutes in a normal person and an average of 20 minutes in this cycle. People with mild premature ejaculation have less pleasure than normal people, and those with moderate premature ejaculation are much less, of course, those with severe premature ejaculation. We will continue through this cycle. Now here we have a moment of ejaculation reflex. This is very important, because after this moment, that is, after the ejaculation reflex comes, we cannot control it. Just as we can't control our heartbeat, we can't control this area. Where is the territory that we can control? The section before the ejaculatory reflex comes. We are working on this in a functional way. The controllable is to control the territory. How do we check? It is necessary to control our physical excitement. The important thing here is that I tell all my patients, your sexual excitement may normally be high, but your physical excitement should be low during intercourse. We can achieve this with muscle and breath control. As a result, since the ejaculation reflex will come later, we can control ejaculation in this area. This method has been applied since 2006. Its finder is also French, and drberkkkaratas is still alive and administering these treatments. This is how we extended the zone where it can be controlled. Here, too, we have uncontrollable territory. So what do we do in the meantime? Can we extend it further? Yes, this is called the stop-start technique, which is to stop, calm down and start again just before the ejaculation reflex. We can implement it. The important thing here is to know the situation before coming to the ejaculation reflex and to learn to stand there, to calm down, to control muscle and breath, then to continue again when the feeling of ejaculation disappears, and this cycle continues in this way. This was also found by Siemens in 1956. We have been doing this since then. The third method is the use of special devices that vibrate. Here, too, is technology. Technology isn't always bad. As you can see, technology helps us here. We have some special tools. Especially the lower part of the penis is very sensitive in some people. In order to normalize this sensitivity or reduce its sensitivity, we vibrate this area with special tools. When we give excessive stimuli, the sensitivity of this area decreases. This ejaculation reflex is reached later. When combined with the other two methods, we achieve a very successful result. This was also found by Dr. Zamar in 2012. There is also a special tool for this. It has already received FDA approval. It can be used. As a result, we prolonged our ejaculation pleasure. With the stop and start technique, we extended it a little more and extended the ejaculation time. What's the success rate here? Patients receiving this triple therapy ejaculate in 1 minute if 8 to 10 minutes after this treatment. In other words, there is an increase of 8 to 10 times. Spousal satisfaction is also about 80%, duration from 8 to 12 weeks. Is the duration fixed? No. Some of my patients learned this job in 3 weeks in this triple protocol. But some of my patients learned in as long as 1 year. But in general, you make an effort in an average of 8 to 12 weeks, you persevere, if you want, this job is done in 8 to 12 weeks. We work for 20 minutes a day. There are 2 doctor visits per week. Our distance education program will start soon in 2 months. Here, too, this problem can be solved in 8 to 12 weeks by passing a new stage in 2 weeks by passing the stages and steps in 2 ways per week. Premature ejaculation is a solvable problem that can be solved. Please get treatment for premature ejaculation. Don't run away from it. Thank you.